This presentation will be discussing disease transmission and infection prevention. Today's lecture presentation is going to be focused on PPE, hand hygiene, and really how to keep yourself safe when you're sitting chairside. We'll also look into the different types of PPE and how they need to be worn. Standard precautions is what is followed on all patients, regardless of their diagnosis or their infectious status. So what we do for one patient, we do for all. So what that refers to is what PPE we wear, what disinfection process do we follow. We want to make sure we're doing the same for all patients. Other potentially infectious material, also referred to as OPIM, refers to blood, all body fluids including saliva, oral tissues, and non-intact skin, so cracked lips and ripped cuticles. Aseptic techniques is what's required in order to eliminate infectious diseases in the dental operatory. So saliva, blood, as we just talked about with our OPIM, that's in our patient's mouth. It can spread in the operatory. So we want to make sure we're following the aseptic techniques in order to help reduce the risk of spreading that infectious material. So following our standard precautions and using all of our barriers and wearing our PPE is going to help do this. As I mentioned before, infection control procedures are followed for all of the same patients. Again, it doesn't matter what their health history says. California regulations require that standard precautions are used for all patients regardless of health history, and that the dental assistant needs to think of all patients as being infectious because we don't know. So it's very important that we are handling all instruments, we're cleaning and we're disinfecting, we're sterilizing, we're doing the same for everyone, but we are following those standard precautions in order to protect ourselves. Hand washing is one of the most important things we can do to help prevent transfer of microorganisms from one person to another. So what that means is washing our hands as soon as we take our gloves off, before putting new gloves on, when we come in at the beginning of the day, when we leave at the end of the day, before we go out in the community, before lunch, when we come back from the community after lunch, or anytime we touch a contaminated object or surface. In California, it is required that every dental healthcare professional needs to do the extended hand wash at the beginning and the end of the day. So what that consists of is doing our 20-second hand wash and then doing our additional 10-second hand wash. That is our extended hand wash. Now, DVC also recommends doing our 2 consecutive hand wash before and after lunch. Throughout the workday, there's many times our hands need to be washed. This includes before and after removing gloves, whenever we take a break, whenever we use the restroom, anytime we touch anything contaminated or see that our hands have become contaminated. When we wash our hands fast, it's very common to miss areas. These areas occur around the fingertips, around the areas between our fingers. Even you'd be surprised the palms of the hand. So we want to make sure we're spending a good amount of time in washing our hands. That's why our hand wash is going to be for 20 seconds. Sing yourself happy birthday twice, or ABCs once, or time yourself. But make sure you are adequately washing your hands. You're using cool water. Your hands are facing down so the water is running off your hands, and you are scrubbing underneath your nails. Here's a picture of commonly missed areas during hand washing. Notice around the thumbs, notice the purple around the fingertips. Those are the most frequently missed areas. The tan is the less frequently, and then the lighter tan is not missed. Notice, are those areas you're missing when you're washing your hands? Those would be the areas where we can spread microorganisms from not washing our hands properly. So it is very important that we are washing our hands for the amount of time and paying close attention that we are hitting those hard to miss areas. When we're washing our hands, we want to use a liquid hand soap. We don't want to use bar soap because bar soap, as it's sitting there, it forms bacteria. So we want to use a liquid soap, and we want to use with our sink something that we don't need to touch. We want to be able to turn the water on with our foot, our knee, something where we're not having to touch the levers. If we do need to, then we need to use a barrier because we don't want to touch any bacteria and put it on our hands while we're trying to clean our hands. Now, the hand soaps you use at home are antibacterial soaps. These are fine when washing your hands at home. But here in a dental office setting, we want to use antimicrobial because it continues to kill bacteria even after we're done washing our hands. Now, in surgery offices, you may use germicidal. That is going to be a common practice in surgery offices. That is not something we will use here at DVC because we are not a surgery office. Antimicrobial is sufficient enough for the procedures we are doing here at DVC and in most general dental offices. DVC uses Vionex for our hand wash. As you can see, it says healthcare professional hand wash on it, and it also says antimicrobial. Some additional hand washing guidelines are to keep your nails short and well manicured. If they're not short, it's going to be very hard to clean underneath them. That is a requirement of DVC. It's in our handbook that we need to keep our nails short. Rings, you can wear a ring. It needs to be one smooth wedding band ring. Cannot have diamonds, anything where bacteria can get caught in it. So it is important that it needs to be smooth. And you do want to remove it when you're washing your hands so you can clean underneath. Now, any dental personnel with open sores or weeping dermatitis cannot sit chairside with the patient until their condition has improved or their hands have healed. Alcohol-based hand rubs can be used, but in California, they can only be used if water, soap, and a sink is not available. Here in the main clinic, we have many sinks where you can wash your hands, so you will not find alcohol hand rubs in the main clinic. In the mini clinic, there is only the one sink that is foot controlled. When we have 24 students, that's a lot of people trying to use the same sink. So you will see an alcohol-based hand rub in the mini clinic. Now, alcohol-based hand rubs are contraindicated, and contraindicated means when not to use. If your hands are visibly soiled or contaminated, if it's the beginning of the day or the end of the day or before and after lunch, anytime when a hand wash needs to be done. You also want to watch how long you're using the alcohol-based hand rubs. If you're on your 4th or 5th time, your hands may start to feel like you have a lot of buildup on them. That would be a good time to switch to washing your hands. It makes it harder for your gloves to go on. Alcohol-based hand rubs come in gels, foams, or rinses. Here at DVC, we use an alcohol rinse. It's very important that all alcohol-based hand rubs are a concentration of 60 to 95% because these are the most effective. When we place alcohol hand rub on our hands, we want to keep our hands moist for 15 seconds. Once that 15 seconds is up, now we can air dry. We do not want to wipe them with a towel. So you can wave your hands in the air, do whatever you need to in order to get them dry. Rubbing your hands together also helps. DVC uses Vionexus for our alcohol-based hand rub. In order for it to work properly, you do need to use one full pump. PPE is required to be worn during disinfection, sterilization, and any procedures or any time handling contaminated items or chemicals. Now, OSHA does require that the employer provides PPE to all employees without charge. PPE that you'll see here at DVC and in dental offices include protective clothing, so your gown, masks, eyewear, sometimes face shields are worn with your in place of eyewear. Different types of gloves, so our disposable exam gloves, heavy-duty utility gloves. You may even see over gloves out in dental offices, and you will see those here at DVC. The order of placing your PPE is very important. So when we're donning our PPE, we put on our gown first, followed by our mask, then our eyewear, and then our gloves. When we're removing, we're going to do the opposite. We're going to take off our gloves, then our eyewear, and remember to take your eyewear off from behind your ears. Your mask, also from behind your ears, and your gown. And with your gown, we want to fold it inside out so we are able to wear it for our next patient. Protective clothing is very important and that it's worn anytime we're handling chemicals. So when we're disinfecting, if we're in sterilization, if we're sitting chairside, processing instruments. And it's important that the protective clothing, so our gowns, have a cuff and are tight around our wrists. They go to at least our knees, and they're tight around our neck. They also should be fluid resistant. Here's some examples of appropriate gowns. So the one on the left, you can see it goes below the knees. It's hard to see because it's white and her gloves are white, but it is tight around her wrists, and it's tight around the neck. Now this is an open front gown. That is an appropriate kind of gown. The gown on the right is a much longer gown. This could be a surgical gown. It goes longer than below the knees, so it is OSHA approved. It's tight in the back, so you do want to make sure there's no opening in the back. It's tight around her neck. Now the one thing I would note is her cuffs look a little high for me. I would like the gloves to be up and over your cuffs. We really don't want to see your cuffs. We want those to be protected by your gloves. Protective masks need to be worn properly, and that means covering the nose and the mouth and going under the chin. If they're not worn properly, you're putting yourself at risk for infectious organisms through aerosol, which comes from the handpiece, to go into your nose and into your mouth. So we want to make sure the mask is worn properly. If you need to talk when your mask is on, you either need to talk through the mask or take your mask completely off. We don't ever wear them just hanging from one ear or touch it and pull it down so our mouth is exposed. When touching it, that means our hand is touching the contaminated mask and therefore infecting our hand. So we want to make sure we are not touching our mask. If we do need to remove the mask, we remove it from behind the ears, of course using clean hands. It is important that masks are changed after every patient or if it gets wet. Because you are working so close to the patient and there are aerosols, if you're working in a wet environment, the mask needs to be changed every 20 minutes, or if it's a non-aerosol environment, every 60 minutes. When we're touching a mask, we only want to handle it from the side edges around our ears. We do not want to touch the front of it or any other part. So we want to use clean hands and take it off one ear at a time. It's very important that the mask fits well to your face. If it doesn't, you're leaving room where aerosols can come through, which means saliva and blood can also enter. Men, if you have a beard or a mustache, please make sure they are groomed and that they fit under the mask. That way you don't have any facial hair sticking out underneath. If you do, the mask is not going to fit as effectively. Protective eyewear is very important to wear during procedures because it protects your eyes from aerosols. We want to make sure our glasses have side shields and a thick upper top. When we're leaning over, we want to make sure they're fitting tight and close to our face so our eyes are not exposed. Glasses that are not disposable need to be either double washed or disinfected. Glasses that are disposable, the eye part is thrown away while keeping the frames. If the frames have been exposed, those also need to be disinfected. Here's a picture of a patient wearing safety glasses. While the dental assistant and the doctor wear safety glasses, the patient should also. Notice on this patient, they're thick on top and they have the side shields. These are sufficient glasses that can be worn during the procedure. There are 4 different types of gloves you'll see in offices. Gloves are the most critical PPE. The types of gloves we're going to be talking about in more detail are exam gloves, over gloves, nitrile utility gloves. Sterile surgery gloves we'll talk about more in the spring semester when we're in our surgery specialty. Exam gloves must be worn a new pair with every patient. There's latex and non-latex exam gloves. They come in different colors and they come in different sizes. The most important thing about these exam gloves is they are a one-time use. If you put them on and take them off, they are thrown away. They cannot be put back on. So when you're working with a patient and you need to get up, you take your gloves off and leave the operatory. At the end of that patient procedure, you're throwing your gloves away. Every time you come back in the room, you're putting on a new pair of gloves. Anytime we touch anything contaminated, those gloves come off and we put a new pair on. Now, anytime we take our gloves off, as soon as our gloves come off, we wash our hands. Before we put a new pair of gloves on, we wash our hands again. Here's a picture of a pair of exam gloves. Notice the gloves are covering her cuff, especially on her left hand. Her right hand, it looks like it's slipping down a little bit, but on the left hand, it is sufficiently covering her cuff. It's important to wear limited jewelry under gloves. A flat wedding ring is sufficient because it is flat, so it's close to the finger. Any other jewelry that has more of a high setting, you do not want to wear under your exam gloves because they do tend to tear the gloves. It's important, as I mentioned, to change your gloves frequently. If you ever think you touch a contaminated surface or you can see your gloves become contaminated or torn, it's very important to replace them. When we're leaving the patient during patient care and then returning, we're replacing and putting on new gloves. We never put on the same gloves we had on before. They are always thrown away. Utility gloves, also known as nitrile utility gloves, are not used for direct patient care. They are used whenever a room's being cleaned, disinfected, when we're handling chemicals, transporting instruments to sterilization, processing instruments in sterilization, or any other time we're handling anything contaminated. Utility gloves can be disinfected and sterilized. Here at DVC, we disinfect them using our two-step method, which I'll go into more in our another lecture, but we're disinfecting our utility gloves. We do not wash them with hands. They can be sterilized in the sterilizers and then reused. Utility gloves are not a one-time use and they are not thrown away after each patient. We will continue to use those, and that's fine as long as they are being disinfected or sterilized. Here's a picture of our DVC nitrile utility gloves. As you can see, our color is purple. These are heavy-duty utility gloves. They are not kitchen gloves. They are used to protect you in sterilization when you're processing, transporting instruments, handling chemicals, or disinfecting. Please write down any questions you may have from this lecture presentation and feel free to ask me next time we meet in class.